Introducing new pioneering biotech instant direct pen FUE, first time in Oman. Hello friends, I'm Dr. Vivek from Managing Hair Transplant. In this video, we're going to tell you 4 new protocols of 2022, the latest one, which have been introduced into the hair transplant procedure to improve the results of hair transplant. Number 1, instant FUE. As you know, before this, most of the grafts which used to be taken down from the donor area was there outside the body for 2, 3, 4, 5 hours and then implanted. As you know, if we cut the finger, we would like to put it back immediately. The time it is outside the body, the less chance of survival of this finger. Similarly, now instant FUE means we take out the grafts and implant simultaneously. We dramatically reduce the outside scalp time of the grafts so that it gets back its nutrition, it gets back to oxygen, it gets back to the blood supply as soon as possible. This has improved hair transplant results dramatically well. Number 2 technique. As you know, when the hair grafts are taken out from the back of the scalp, there are some white dot microscarring. Now that cannot be eliminated, but that can be reduced with an introduction of PR for hair, which is a very good healing mechanism, and few products which makes healing much natural and reduces the scar as much as possible. Number 3 technique is use of keep implanters. As you know, when the forceps are used, sometimes the graft can be crushed, the grafts can be damaged. If it's a curly hair, then it's difficult to put with the forceps, and there are certain other difficulties with the forceps. If the graft is bigger in size and the slit smaller, it's difficult to push inside the slit. So with the keep implanter, there's a device where the graft is preloaded, and with the help of the device, just by gliding, the hair grafts are introduced into the slit. So this is called no root touch technique, and it has improved and reduced the chances of damage to the hair grafts. The next important technique is what after hair transplant. As you know, till now, when the hair transplant done, only spray was given to keep the graft moist. But as you know, it takes 5 to 6 days for a basic neovascularization or anastomosis to develop so that the graft start getting oxygen, nutrition and its blood supply. And it takes 2 weeks for good blood supply, good neovascularization so that the graft can survive on its own. So that means from day 1 to day 10 post-surgery, it's very critical so that the graft should take up. As you must have known, even with the best of doctors, with the best of techniques, sometimes the graft doesn't take up. So to counter or to fill this gap, we have introduced new PRF treatment which we give after the surgery, which lasts for 6 to 7 days and support the grafts. We also have some special solutions which has got good nutrition, specially made for the hair grafts, which we give it in a test tube and a syringe to the patient to be sprayed on the grafts twice a day for first 10 days. We call the patients 3 days after the transplant and then again 3 days after the transplant so that the post-transplant care is taken care of. So this is a new addition, 1 to 10th day post-hair transplant care to make the survival of the grafts better. So friends, keep watching our videos. We'll get you updated, the latest in the field of hair restoration, anything, any protocol developed anywhere in the world, you will be the first to know. Thank you and goodbye and see you soon.